Meteorologist Ray Staging on News Talk 760 WJR.
You're hearing the Paul W. Smith Show, News Talk 760 WJR.
And I'm glad you are on this cold Friday morning here. We're hearing an awful lot now with this wave, this latest wave of COVID, this latest variant, Omicron. We're hearing more than ever about the children. Record admissions of kids in hospitals now. So we're going to the expert who we've turned to in the past, Dr. Rudolph Valentini. Dr. Rudolph Valentini is a DMC Group Chief Medical Officer and a pediatrician working with those kids. Good morning, Doc. Nice to have you back on the Paul W. Smith Show.
Paul W., thank you so much for having me.
Well, it is our pleasure. I wish we weren't talking about this, but we've been talking about it for 2 years now. But the children are now more involved than we ever thought they would be. Give me just your analysis of where we are now.
So you're absolutely right. We're seeing greater number of children being hospitalized across the country, across the state, regionally. I think the state numbers are up about 2 to 3-fold over record highs. So these are record highs now. So what are we seeing? We're seeing it doesn't appear as though this is quite as nasty as earlier iterations of COVID. However, still about 20% of the children are ending up in the ICU. And as I said, numbers are 2 to 3-fold higher than before. Most of the time they're younger children under 5 because they're not eligible to be vaccinated. And that's what we're seeing. We're seeing a lot of respiratory symptoms. What's being reported now is more of a croup type symptom. The Omicron variant, which is the predominant variant that we're seeing now, tends to settle in more in the upper airway. So lots of kids are having that barking steel-like cough, lots of respiratory where they need additional oxygen and support to help their breathing. Some kids, it just happens to have COVID with a little bit of fever and maybe they were injured and they come into the hospital. We test everybody before they're being hospitalized to make sure we can isolate appropriately. So not every single child being hospitalized is actively infected with COVID in the sense that that's what's putting them in the hospital, but the bulk of them are actually suffering from symptoms of COVID.
You know, with what you just said, Dr. Valentini, it reminds me I should remind our listeners, although I think our listeners probably know this, just going to say it anyway. There are a lot of places to get vaccinated. A hospital emergency room is like the worst place you can go. The reason being, you're going to be surrounded by people with COVID when you go into a hospital emergency room. Not necessarily the case when you go to the urgent care or your doctor's office or wherever, the pharmacy, wherever else you're going to get your shot. Just a note there. And when we talk about these kids under 5, it is like the croup, from what I'm told, these kids under 5, which is a horrible sound coming from those little babies.
Yeah, it's true. And so, traditionally, croup is something that pediatricians are very familiar with. Before coronavirus, this iteration of coronavirus, we had a couple of things that typically cause it. So pediatricians are very skilled at treating and recognizing croup. But yeah, it can be kind of scary. And but right now we have a third pathogen. It's usually something called para-influenza virus. Sometimes it's called RSV that can cause croup. But now we have coronavirus on there as well. So yeah, that's true. And your other point about where to go get vaccinated. I mean, you can get vaccinated, at a local pharmacy. And we're actually, you might know, we're doing a Pfizer vaccination clinic downtown at Children's tomorrow at the DMC Children's Hospital. So that's another opportunity for folks. And this is a partnership between the Detroit Health Department, the Detroit Public Schools, and the Delta Sigma Theta Sorority Incorporated, and it's the Detroit chapter. So it's a 3 or 4 person partnership. But they can come to Children's tomorrow between 8 and 2 and get vaccinated, and that's for dose number 1, and come back in 3 weeks, which would be the 29th, and get their second vaccine. So that's an opportunity as well.
Speaking of doses, some people are looking already to a 4th dose, a 4th shot coming. And I'm just wondering if we're going to, there are some doctors now saying also, even doctors that used to be aligned with the president but now have kind of broken away and say it's time to look at this completely differently. But they're talking about living with COVID and living with it like it's the flu, for example. But with the flu, we get 1 flu shot a year. If we're going to have 4 shots in a year, that's not just like the flu.
Yeah, that's an interesting thought. I do think that the sentiment is changing a little bit. I think that, at the very beginning of this pandemic, rewind 2 years, we were looking for any defense we had. And it's almost every vaccination you get, even young children when they're getting the flu vaccine, they get 2 early on, so you sort of have to prime the immune system. So the first 2 vaccines makes complete sense. And then really think of your flu shot once a year as your booster. I think right now we're still scrambling to try to catch up with this virus. Until we get, a higher vaccination rate, it'll continue to mutate and continue to try to be a couple of legs up on the rest of the public. So I do think at some point the vaccines that we currently have are probably going to have to get redesigned because this version of this variant does appear to be less responsive to the vaccines that were originally developed for kind of coronavirus 1.0, if you will. So I think that we're going to need new vaccines because the flu shot that we get every year is different. The one we get in 2021 is different than the one in 2020 or 2019, and it's all done based on sort of projections of what this year's flu strains are going to look like. So I have a feeling that's the direction we're going to be heading, and probably what you just have been hearing and I've been hearing as well is that eventually this may have to, I guess, kind of weave into our daily life. But in the meanwhile, because this is much worse than the flu. I mean, it's filling ICUs up, and we've lost so many people from coronavirus that we've had to take this with much greater respect than your traditional influenza. It does appear, though, that this version of COVID is a little milder, and maybe we're all going to eventually get along. But in the meantime, I think we have to vaccinate, and then until we can get ahead of this, because right now, again, hospitals are being relatively overwhelmed with high number of cases. And then there's lots of other diseases out there that need to be cared for. People with diabetes, people with high blood pressure, people with heart failure, people with cancer. And they're all competing for the same, resources. So we really have to try to calm COVID down so that we can continue to care for people that have regular traditional illnesses. And I hope in the maybe several months down the road, we can eventually catch up with this thing so that we can all learn to live together.
Doctor, quickly, before we run out of time, we heard first from Henry Ford Health System, some 766 staff members out. Trinity Health, 900 medical personnel out. Beaumont, most recently, 430 employees and counting out with symptoms. How are we holding up there at Detroit Medical Center?
We definitely have a few hundred out as well. We are trying to take advantage of the new CDC guidelines around returning to work, which I think was a really good idea. It's trying to get people, if this iteration of COVID is milder than before, if the people that are getting it are really breakthrough infections and they have very limited symptoms, probably keeping people out of work for 10 days is no longer as logical as it once was. So if we bring people back to work and we religiously expect them, and they will, comply with the need to wear the right PPE to protect themselves and those around them, we can get them back in the workforce earlier. So this is sort of new information that came out just after Christmas, just right around Christmas. So I think we're going to see the health systems adapt a bit because we just need these folks in the workforce to be able to care for folks.
Absolutely.
Because this coronavirus isn't going away.
No, and we've learned that we don't want to kill businesses with people or people and businesses. I mean, we need both to survive. Dr. Rudolph Valentini, Detroit Medical Center pediatrician, DMC Group Chief Medical Officer. We continue on the Paul W. Smith Show.